What up, Doc? In this video, I'm going to be talking about the 6 tools that you're going to need to get excellent dental photos. And the first thing we're going to talk about is the A7 III by Sony. Now, this is a full frame camera, and this is equipped with a 90mm lens. This is not stock, so what you're going to have to do is get the body first and then the lens separate. But this is a great macro lens, so if you want to do close-up shots of veneers or crowns or whatever you want to do. The only thing that it doesn't do well is portraits, unless you have the space, so you might have to back up. If you want something a little bit more versatile, I would go with a Tamron 28 to 75mm lens. I think that's a 28 to 75. Second, we're going to talk about is the lip retractor. Now, I primarily use this for Invisalign photos or ortho photos because it's going to be showing me the rotations of teeth. I don't use it much, but I've been using this for about 12 plus years. I would highly recommend that you put these in a cold sterile or wipe them down with Canva. Next we have up is a mouth mirror. Now, the mouth mirror is for occlusal shots. Typically, people use the kind of mirror that has a bend in it and has a small end and it has a big end. I started using this probably a couple weeks ago and I love it, and I'm going to tell you why. The problem with doing occlusal shots, as you may already know, is keeping fog off the mirror. And one thing that this does well is keep the fog off the mirror. So what it has a built-in light and it has a fan. I don't know if you can hear that. So it blows air away from the mirror, it keeps it from fogging up, and the light really helps with keeping all the teeth lit up. And by the way, all the equipment that I'm showing here I use every single day, and the link will be in the description if you're interested in any of these. These are all bought on DentiPhoto. Next is the black contraster. I'm sure you've seen this on Instagram, Facebook, wherever they post their pictures on social media. And one thing about the black contrasters is that I see a lot is that dentists, what they'll try to do is they'll take their photos with it really close to the occlusal plane like that. But in actuality, what you want to do is bend this down to about 45 degrees, and what it's going to do is prevent a reflection of light right here on the black contraster. It's not a big, huge problem, but it saves you on time from editing it out in Lightroom Classic. Let's see, second to last is the retractors. Now, I chose these specifically because they are see-through. Now, with traditional retractors, they have they're just a piece of plastic, or even the metal kind. It's this whole inner part is all metal or plastic, and what ends up happening is that the sensor from the camera doesn't know what to bounce the sensor off of. So for instance, when I'm taking dental photos, I want it to bounce off the skin tones in the teeth so that it projects an accurate exposure for the camera, so it knows how to do the auto settings. With these, I found out over the years work the best because the sensor is using bouncing off the skin to get a correct exposure. And the last thing I want to talk about are the lights. Should you get constant lighting or twin flash lighting? I recommend that you get constant lighting because it's just a plug and play. You turn it, it's one setting, one brightness, and you just have to make the settings in your camera and it's done. The biggest problem with the twin flash system is that it's so damn heavy that you have to get an extra assistant to help you take the photos. If you are interested in a dental photography course that's free, there is a link in the description below, and make sure that you watch the next 2 videos that YouTube puts up because YouTube thinks that you'll like those the most.